A very warm welcome to the Nomad Dot Healthcare Stories podcast. We've got a wonderful guest with us today. Her name is Folake, and she is the CEO and founder of Emergency Response Africa, ERA for short. Um, and we'll be talking about emergency care and the delivery of that service in Nigeria. So I'm going to let Folake introduce herself, and she's going to tell us a little bit about her journey into this entrepreneurial life, and how she came about to set up ERA. So over to you, Folake.
Okay, thank you so much, Ivy, for having me. I'm looking forward to the conversation. This is a topic I'm very, very passionate about. So yeah, very happy to share. I'm Folake Owodunni. I'm the co-founder and CEO of a health tech company called Emergency Response Africa. And Emergency Response Africa started because we saw the huge numbers of preventable deaths that were happening in the country, simply because people didn't have access to emergency response. I always share that I had an emergency myself back in 2017 with my son in particular. But because it happened outside of Nigeria, I could call for help and get that help quickly. And I think, realizing how differently that could have gone if it had happened in Nigeria really sparked something in me. I started to look at, well, what do people do when they have an emergency? Who do they call? What action do they take? And the more I looked at it, the more clear it became actually we didn't really have a good way of dealing with emergencies. Oftentimes we end up doing things that don't necessarily help the patient.
Yeah,
And yeah, there's just no reason why so many people die,
yeah,
from different things that could have been prevented. And so that's really why we exist. Our goal is to reduce, ideally, eliminate, the deaths that could have been prevented. We want to be able to get rid of that problem.
yeah. And that's truly amazing. We think, a lot of the emergencies that happen in Nigeria, as you mentioned, are completely avoidable, from the
Mhm.
traumas to the things that happen in the home and to people just being
Mhm.
unwell in general.
Mhm.
So tell us a little bit about your background. Were you a healthcare professional before? Did you just work in the healthcare space? And how did you transition to the entrepreneurial path?
Yeah, good question. So, I was definitely that child that grew up wanting to be a doctor. Had the, doctor kit, like that was by far my favorite game to play with my cousins. And so for me, I think growing up, it was very clear that I wanted to be in the healthcare space. But I think I realized over time that the core motivation was the desire to help people.
Yeah,
And of course, if you grow up in a Nigerian/African household, you know that there are only like probably four or five professions available.
yeah,
And, the closest one was to be a doctor.
yeah,
So that was always, kind of my goal. But I also joke that I had an early life crisis. So while most people have a midlife crisis, I had mine early. And I very quickly was like, I don't know that I want to do this or that this
yeah,
addresses what I'm trying to go for. And I think in the course of that, I stumbled on the field of public health. And that really spoke to me about kind of the large scale impact I wanted to have and the ability to see health, but in the context of all the things that influence health. And so that led me to the field of public health. So I have a master's in public health, but I also then pursued a master's in business entrepreneurship and technology. And that came because I think, a lot of my early work experiences were within the healthcare sector in different roles. But I started to feel, like I was a little bit boxed in, like I
yeah,
didn't quite understand the world around me and I needed, bigger perspective. And so that led me, down the path of, management consulting. And then I did the business program. And I think that, what we do at Emergency Response Africa today is very much a combination of those things, right? So it's taking, the sort of traditional field of healthcare, if you will, and public health, and then thinking
yeah.
about it from the lens of innovation and business and impact, and how can you, bring those things together. And so I think for me, it was really about taking pieces of things that I loved and enjoyed and resonated with. And then a problem that I really care deeply about. And that's kind of what brought me into entrepreneurship. I never thought I would be an entrepreneur. It wasn't in my life plan for myself. Um, but they always say like, so apparently there's research that if, people whose parents are entrepreneurs oftentimes are actually more likely to become, and both my parents have been entrepreneurs for all my life. And so maybe it's not all that surprising, but certainly for me, it was a bit of a surprise.
Yeah, and certainly it's been a gift to the Nigerian healthcare space that you went down this path.
Mhm.
So tell us a little bit about, the services that Emergency Response Africa provides, and walk us through what is a typical, patient journey, so to say.
Yeah, thanks. So Emergency Response Africa provides a set of services that are really geared towards getting patients the help they need as quickly as possible at the scene and ideally, to the healthcare facility. So everything in the realm of pre-hospital care is, really what we try to provide. So for us, what that looks like is, ambulance services, emergency ambulance services, but also, inter-hospital patient transfers, and this is both local and across state lines within Nigeria. But we also then provide other types of services like event standbys. So, just having major events where, of course, there's a chance for someone to be ill or hurt in some way. We provide ambulance services for that. And then training is another thing. We saw very clearly that there's a really big gap in terms of knowledge and skills on first aid. And so we set up a training program that allows us to deliver first aid and CPR training, basic life support training. We also started training medical dispatchers because that's a huge gap, in Nigeria as well. And so those are some of the services. We do provide corpse evacuations as well, which is not a service you typically advertise, but it's something that's, a very needed service for grieving families as well. So those are, all some of the things that we provide. I think the last thing I'll say is around health and safety. We support companies in what we'll call emergency preparedness. So it's one thing, of course, to respond. It's another thing entirely to look around and say, okay, well, what are the potential risks and how do we mitigate against those risks? And so we have companies that we support in conducting emergency preparedness assessments, and just providing recommendations on how they can, protect themselves against certain risks. So that's a summary of what we provide. Now, in terms of the patient journey, it looks a little bit different depending on what's going on, but I'll give you kind of a typical. So Emergency Response Africa takes a bit of a different approach from perhaps a standard ambulance company in the sense that we are an aggregator of ambulances and first responders and hospitals to create a system that can connect people to help as close to them as possible, as quickly as possible. And so what that looks like practically is that while in-house we have some of our own ambulances and our own paramedics, the bulk of our network is actually made up of partnerships. So we partner with private ambulance providers, and we've created a network that just means that if somebody needs help, we can get help that is closer to them and hopefully cut down the response time. And so, when somebody has an emergency, and I'll just use an example of perhaps a case where there's already an existing relationship. Maybe they're coming through one of our insurance partners or our corporate partners. They can simply call our toll-free number, which functions 24/7. And in calling that, they're onto a medical dispatcher who then triages the situation. They have a set of questions that they ask, simple but effective to really get to the heart of, is this a major emergency? Is this something that's relatively minor and can be supported over the phone? It really depends on the situation. But let's assume that it was identified that actually this person does need help where they are right now. The dispatcher will then use our technology. So we have a proprietary dispatch platform that we've created for this environment. And they would use that technology to identify and dispatch the closest available response team. So again, depending on where we are, a response team can look different. But again, let's speak in terms of typical.
Yeah.
That could be an ambulance that's close to the patient. And we would then communicate with that ambulance and they would be on their way. They get to the scene, provide care. If the patient needs to go to the hospital, they either will perhaps have a place that they already know or they already have a relationship with, or we can recommend one of the hospitals within our network. And in general, any hospital in our network is one that we have actually gone to and satisfied ourselves that, okay, these are the types of cases that we can bring here. And we know that they will get a decent, level of quality of care. And so, the patient gets picked up, they get transported to the hospital, and they get handed over. For us, what matters post handover is then collecting feedback about the patient's experience. So how was their experience calling? Did they feel supported? Did they feel the empathy? Did they feel like the communication was clear? How was the journey to the healthcare facility, both in terms of like the experience of it, but also the care received? And then finally, the handover process. How smooth was that? We always want to know, like, would you recommend this to other people or no? Because if the answer is no, then that means we have things to fix. So that feedback is also really important, and make sure that, within 48 hours of the case, we're collecting that feedback and we're using it to improve our services. So that's kind of an end-to-end patient journey. I will say that in situations where, for example, we work outside of city centers, usually that's like in collaboration with maybe like a government partner, our responders look a little bit different. So these are now maybe lay people in the community that we've trained as community first responders. These are people that maybe are using their own vehicles or they're using available government vehicles, but they're serving the same purpose of connecting people in community who need help quickly to the healthcare system and providing that initial bridge.
And that's truly awesome, that this service is available. Because if you ask the average Nigerian, they'll probably tell you that, there's no ambulance service in Nigeria, whether in the
No, there
public or in
is,
the,
there
in
is,
the private sector.
and I mean, depending on where you go, and maybe we'll get to this, there are definitely services, depending on where you go. Some are more robust than others, and then there are a lot of places where there is nothing. So it's the truth. It just depends on, where
Where you
you're
are.
looking.
Yeah, and you just hit the nail on the head on so many things there. The fact that pre-hospital care in Nigeria, it sounds like it's informally set up, so there isn't a proper referral pathway as far as most people know. And a lot of people are not plugged into a network for where there is an existing service. So my question to you, because you mentioned that when the responders go, they judge the situation and then go to the appropriate hospital. So do you have certain hospital that you take patients who've had a stroke? Do you have a certain hospital where you take a patient who has a heart attack, for example, or where they're having just a general mild fever, whatever it might be? Is that something that's set up in your triage and referral scheme?
Yeah, absolutely. So part of the process for us for onboarding a hospital is to really understand what are they really good at, right? So yes, a hospital is a hospital, but we know that actually a hospital is not, they're not
Yeah,
all the same.
yeah,
And there are certain cases that if you take here, they aren't going to get the best care versus somewhere else. And so when we're onboarding different healthcare facilities, the biggest thing we need to know is what types of cases can we bring here?
yeah,
And what types of cases should we not? And so that's part of why, the role of the medical dispatcher is really important, but so is the role of the technology. We've
yeah,
actually created our system to have algorithms that actually recommend the appropriate pathway of care. And it sounds really nice, but the truth is there's also a lot of manual work that has to happen, just because, it's Nigeria and things don't always work as smoothly as we would like. But the short answer to your question is yes. we absolutely always want to take patients to the right place the first time. And that becomes important when you think about what people typically go through in an emergency. It is not uncommon for people to go to 3 or 4 different hospitals before they receive definitive care,
Yeah.
right? The care that will actually help them. It's not uncommon. And
Yeah.
so having a system whereby, maybe we take a little bit of extra time to think about what is it that this person really needs and how do we
Mhm.
ensure that they end up where they can get that, I think is hugely important. And we certainly try to do that. The things that add some complexity to it, and I think, again, this is part of just recognizing the environment that we operate in. If a patient is coming, as a private patient, right? There's a cost attached to seeking healthcare in Nigeria.
Yep.
And so even if, let's say someone's having a stroke and the best hospital for them is, hospital A in this location, it's close by, they have, all that it takes, but the price point is,
Mm.
far beyond what the patient can afford, right? You have to be able to offer them hospital B and C and D. And so those are the things that sadly, make it more complex to deliver care in this environment. But
Absolutely.
it
Yeah.
is the reality of what
Yeah.
we face. And so it forces us, to sort of think again widely about our network and about who we're serving, think strategically about partnerships, but also just, be open to the fact that sometimes what the patient wants and can afford may not necessarily equate to the best or what they need. And we have to be able to support them in their journey, whatever that looks like.
Yeah, I mean, it sounds, as you say, very complex, and and this is something you have to do quite rapidly in that
Mhm.
situation as well.
Mhm.
So being able to power that with technology and with sort of business intelligence, as you said, in terms of the feedback that you're collecting is, I'm sure it's quite profound and very
Mhm.
useful on a daily basis. So,
Absolutely.
I'm going to go back to some of the things you said, but I want to understand. You talked some of the challenges, but when you were setting up, you know, what were the challenges that you faced? Were they infrastructural? Were they financial? Or was it a human capital challenge, so to say?
I mean, it's definitely all in different ways at different times, right? Um, so I think like right at the beginning, in terms of setting up, we were a bit fortunate in the sense that we had the opportunity to almost like do a trial run on some pieces of the puzzle before almost a full year actually, before officially starting. And so that allowed us to, for example, say, okay, well, we know we want technology to be a big part of this, but what does that technology need to look like? What does it need to be able to do? We know that we want, for example, to be able to train lay people in communities. What does that training need to look like? Who is eligible to participate in that training and who is willing and open to receiving care from those people that have been trained. We know that we're not a not-for-profit. So how are we going to make money while still trying to figure out, the equity of, getting people access to care? So these were all the I would say, very difficult questions that we had to try to figure out answers to. And this is, kind of where the business entrepreneurship and technology program became valuable. My co-founder and I actually met in that program, but taking an iterative approach to say, you know what, how about we just start by, testing a couple training models, testing some technology, seeing what impact that has on response times, just testing certain elements of it and seeing what works and what doesn't. And then when we formally started, some of the bigger challenges that we started to face were like on the human capital side. And I think that's like an ever-present challenge. I'll give you an example. The first person we hired to play the role of medical dispatcher was a nurse, and that was intentional, right? We wanted somebody who had, some clinical acumen. We knew that, again, medical dispatching is not a field here. It's not a thing that people go and study. So you essentially have to train people on the job, and we were okay with that. We did what we needed to do. And we hired someone who, on paper and from interviews, seemed solid. And then we, had her sit down, and it turns out like she was typing like this. I don't know if people that are listening can see what I'm doing, but I'm like pointing my finger.
The finger type.
Yes, my finger, the finger, the two finger type.
Yeah.
And was incredibly slow, of course. And so,
Yeah.
we started asking some questions about general technology use. And it turns out that, I mean, yeah, some, right? But that wasn't her everyday. And even if it was, there was no requirement to, type super fast. You weren't using multiple platforms it just
Yeah.
it didn't work. And so I think we had her on the team for all of, I'm not even sure it was 2 weeks, maybe 10 days. And it was a mutual parting, no hard feelings. But I think the lesson for us was, you know what? Just because somebody sort of fits the bill in what you think is core to this role, there are so many other parts to it that you need to be able to look at. Don't assume, computer literacy. Don't assume critical thinking. And I think that over time, of course, that has evolved. And so there are many, many challenges. I mean, getting accredited as a provider was another challenge. So, like I said, we're not a typical ambulance company. And so what the accreditation agency had structured as the requirements for registering an ambulance company, we didn't fit that bill. And so we spent probably the first year and a half, maybe even up to 2 years, going back and forth with the regulator to say, we have paramedics on our staff, but no, you need to have nurses. But actually, paramedics are the folks trained for emergency response. But no, you need to have nurses. Like that level of conversation and eventually we had to figure it out. So I say all this to say there were myriad challenges. It just depends on which one you
Which one
look
to
at.
pick, right? Yeah. So
Yeah.
again, a couple of things you mentioned there, and I must say I admire the tenacity to hire quickly and fire quickly when there isn't a fit and an
Trust me,
alignment.
it's not always been that easy. It's not always been that easy. So
Because I do think that is one of the biggest challenges, managing your human capital and, where
Mhm.
things don't align, being able to change strategy on that. As you say,
Mhm.
CVs don't always translate to effectiveness in the workplace. And that's certainly something we're finding out on our end in
Yep.
Doc. So I want to talk
I
about a
can
little bit about some of
imagine.
those challenges that you said, which is about
Mhm.
infrastructural things. So you talked a little bit about, getting registered with a regulator and going back and forth and should we call it the gymnastics of dealing with
Mhm.
public entities sometimes and the pace at
Yeah.
which they get things done. Are there other sort of infrastructural things that, no matter how much you try the private system, there are government infrastructural things that you really just have to navigate and wait for them to deliver on, for it to make it
Mhm.
easy for you to deliver your service? Because, for example, I think of the pre-hospital side of things and emergency care. And one of the biggest
Mhm.
infrastructural things that I would think is road safety. So,
Mhm.
if you could fix many of the potholes on the roads, it would
Mhm.
probably halve some of the trauma on the roads. That's
Mhm.
one
Mhm.
example I can think of. But I want to hear from you, what you think about something that's impacted service delivery for your company.
Well, I mean, definitely the road thing popped into my mind, but I think I'll focus on like two things kind of core to the health sector itself. One is what I would call the bed space bingo, if you will. And the second is really about payments. The bed space issue is not a Nigerian issue, right? It's not unique to Nigeria. There are many countries where that is in cities. Maybe it tends to be more, kind of at a city level where that's a big issue. And so, from that lens, I also say it with a bit of empathy that, it's not an easy problem to solve, period. But it is a big problem, right? Because like I mentioned, where you take a patient to is a function of many things. First and foremost, what do they need? But secondly, what can they afford? What type of longer term care might they require? And one of the things that we've seen really, really clearly is that, there are patients for whom it only makes sense to take them to certain public facilities. but these facilities are in high demand. And because even though we have, our three-tiered healthcare system, people regularly skip over the primary healthcare level and end up in secondary and tertiary facilities and fill them up. It's very challenging sometimes to find a space for a patient in a facility that is where they actually need to be. And so when you think about the ripple effect of that, right? So it affects the patient themselves in that they're waiting so much longer for care. It might mean more complications, or certainly more costs to treat them at the end of the day. But for the service, it also means that you have assets that are tied down. And the moment they are tied down, they become an extended hospital bed in the ambulance. They're doing what is outside of their scope of work. That's an issue. And it also means that they are not available to attend to others as well. At least I've had some really interesting conversations with other people in the healthcare sector about, some sort of like bed space finder or a bed space counter. I remember even being in one of those parking structures that have the little like sensors and you can kind of see the count, and like, man, like, could we apply the same? Maybe we could, right? But who is ready to take that and who is able to do it across the public and private sector? And who's that, right? Because that's not a service in itself, right? So again, that's I think, one of the infrastructural issues that certainly needs to be addressed to make the whole system, just work more efficiently. I think the second one I was just going to talk about really quickly is around payments. And it's just such a big issue because at the end of the day, it is the one barrier that stands between kind of the average patient, or as they say in the pre-hospital case, the unknown patient getting care. And so, the government has taken different efforts over time to address that. They've created, the basic healthcare provision fund, and they've apportioned, a percentage of that to provide emergency medical treatment. And, they've had some, leadership shufflings to, kind of move in what I would say is the right direction overall. I think as with everything in Nigeria, and maybe it's the federal system, maybe it's something else, I don't know, between policy and implementation is always really wide. And so I think we're trying, at least the engagements that I've had with the public sector tell me that at least on the surface, there's a desire to genuinely see this change. What will happen remains to be seen. No one can do this on their own, including government, so it has to be a collaboration. But yeah, it's definitely another infrastructural challenge that, if solved, honestly unlocks the market. It makes it easier for hospitals to invest in ambulances. It makes it easier for private companies to thrive in that business. And I would say the two top things.
Yeah, and thank you for sort of explaining that, because I think, as you said, the bed thing is a universal problem across the healthcare ecosystem. And one of the things I've come across, when I've worked in intensive cares and sort of air ambulance space, one of the things they try and do with the network is that every morning there's a tally of like available beds that's supplied to, quote unquote, a command center. So maybe that is something that in the future, the command center in somewhere like Lagos could implement and maybe make that a little bit easier for everyone. So, my next question is kind of along the same lines. You had mentioned about doing emergency preparedness assessment for different organizations. And I wondered whether you could talk a little bit about, what does that look like? Because, for example, we have so many events now that happen in Lagos and Abuja, and that attracts international people, travelers coming into Nigeria. And it's always a fear of mine when I think about, somewhere like Lagos, for example, where there are very few roads in and out of, like the island. And if a major incident happens, how prepared are the government's healthcare system able to kind of contain that and manage those kind of situations? what does it look like for a major entertainment company hosting an event, where there's an incident, a fire, or something like that? Prepared can they be, and what do they need to do to get themselves prepared so that they can manage situations effectively and no lives are lost? I don't know if you have any thoughts
So,
on
yeah, absolutely. And you know what I will say is first and foremost, the country of Lagos, because that's kind of how it functions, is very, very different than,
that. Yeah.
the rest of Nigeria.
Okay.
So I will talk about Lagos, but I think it's important to preface it, with that.
Mm.
And I will say, like, the truth is huge kudos to Lagos. Lagos tries. When I think about the population that is in this state, and how the population of Lagos is bigger than many countries' populations,
Absolutely.
and all packed in honestly a really tiny strip of land. It's a huge challenge. There's a huge population challenge. And so I think, as much as as much as, oftentimes we give Lagos a hard time, I'm also filled with immense compassion for the people that have to do the work of managing a mega city like
Yeah.
Lagos. With that said, and in spite of all the many, many things that still happen, Lagos has taken certain really interesting and positive steps. One example, especially when it comes to like events, is the Safety Commission, Lagos State Safety Commission. And we've engaged with them quite a bit, but there's clearly a desire to put safety at the forefront of our events industry and entertainment industry. And how does that manifest? Now in Lagos, you cannot easily, I mean, you can because everybody can get around laws if they really want to, but you cannot easily have a major event without having certain things in place. So
Okay.
you have to have engaged with the Lagos State Fire Marshal. You have to get like a permit. You have to have an ambulance on site for your event. Depending on kind of the number, I think it's like if you're going to have more than 250 people, maybe it's 500, I can't remember for sure. But you have to have an ambulance on site, and just a few other things. So in other words, you're planning your event. Event planners know this now. You have to get, XYZ permits in order to have your event. And again, even though people find their way around it, people, you still hear the stories of somebody dancing and they died, like it still happens. But the fact is, Lagos has stepped in the right direction by requiring that and making it so that anybody who is having an event must confirm that they are going to do those things. They must, in fact, in many cases, they're actually paying directly. So again, there are two sides to this. One is that it really enforces safety. It prioritizes it, but it also creates a market opportunity. So I know that we do a lot of events coverages that are paid, and that's a line of business for us. And it's part of what can help a company like ours actually last and be sustainable. And there are others in the same space. So it has both the dual effect of keeping people safe and building an economy. And I think that more states need to be able to do stuff like that, because at least I can tell you that I was talking to someone who was organizing an event. I won't mention the state, but outside of
That's okay.
Lagos. And I was like, hey, we can provide ambulance services. And the reaction was honestly just that, why will I want ambulance in my event? Are we saying something is going to happen? And it's part of our culture of God forbid, right? Like it can never be me. So I say all that to say that Lagos really has tried in certain ways in terms of preparedness. Lagos has, at least I personally know, certain partners that they work with that provide accident extrication services. You're not going to get that everywhere in Nigeria. So Lagos's problem is that the people are too many. That's actually the truth. It's not that they don't have a system. It's not that the system doesn't work. It's that the capacity required to serve the population is huge. And we just don't have the capacity yet, which is where private sector can come in and should. And I think there's things that need to be done in order to make that synergy actually happen. But that's Lagos. Outside of Lagos, there are many places where there is nothing. And so if you get into an accident where you are trapped, well, the local people can come and help, and to the extent that they can open the metal, that's how you get out, right? So it's again, Lagos has tried, they really have, and I do hail them. There's still work to do, but there's definitely some good stuff that's happened.
Absolutely. As you said, it's hopefully a template that will roll out across the country and, across both public and private healthcare system. So what do you think emergency care as a human right actually means to a Nigerian? Because only last night I was watching a video of people where there had been a tanker that had overturned on the road, and people were underneath this bridge,
packing
collecting fuel from this tanker, and it was quite saddening to think that it felt like those people did not recognize the danger that they were exposing themselves 100%. To, and B, that incident happened at all in the first place. Why did that tanker overturn? I mean, there's so many issues around it. But for an individual, what does emergency care as a personal right, basic emergency care, what should that look like for a Nigerian?
I would say it should look like the ability to call either for yourself or someone else, a number, ask for help, and get it within a time frame that actually means that the person has a chance. That's as simple as it is for me, right? So maybe that means, getting it quickly, at the scene, or being able to know very quickly where they need to go, for further care. It means, not having to make the choice between should I take this service because, or should I avoid taking the service and put the person on my back and start running because I can't pay for it? Or should I go to my traditional bone setter because if I go to put a cast on my leg? These are the real issues. We have people that will come and collect their patients and take them to the bone setter. Why? Because they can't afford, even if somehow they manage to pay for the removal from the scene of the emergency to a healthcare facility, they can decide that, what, care stops here. Let's carry them to the people that we know. And sometimes it's a function of cost. Sometimes a function of trust. And both of those things, I mean, you can't deal with one without dealing with the other. So I think for us as Emergency Response Africa, part of the public health work that we do is when we are implementing these emergency response systems in, kind of the more rural areas, campaigns and community engagement and direct interfacing with the leaders and leaning on their expertise and their influence over their communities becomes hugely important. Because the truth is, if people don't trust, first of all, they're not even going to use it, even if it's free. And then the fact that it's now not free, is another matter entirely. So I would say, what does it look like if it's truly a right? People should be able to call for help and they should be able to get it. Simple.
And honestly, I completely agree. I know that, there's been a lot of discuss recently in Nigeria about emergency pre-hospital care and emergency care services available. Obviously, because of the high-profile cases like the Anthony Joshua situation, like the drowning incidents from the boats that capsized in Lagos, and just a few things that have happened. The building that burns down in Lagos Island about a month ago. How do you rebuild that trust after sort of decades of, systemic failure and people feeling like the healthcare system has actually failed them?
So maybe I'll speak from the experience that we've had working in two places, a city, so not a Lagos, but Benin City, like a rural community in Ogun State. And I think we are hungry for solutions. We leveraged really all the video. We did the mosques, we went to schools, we went to the primary healthcare centers and the hospitals, so it was a combination of locations as well as direct engagement with people. And what was the message? Number one, this is a solution that's here for you. Number two, here's how to use it. It is not for when you have a headache. It is not for two chickens fighting outside your gate. This is a real call that we have received. It is not for, I need a ride to the market. This is when it is for. And if you call us, this is what I expect. And then, of course, if we communicate all that, we have to then deliver on what you can expect. Now, a big part of our strategy as an organization is, as I've already mentioned this, and I think they are actually the key to building trust or rebuilding trust in our systems. Why? Because a community first responder is already in the community. They live there, they work there, they're a member, they're trusted, they know, people know them. The difference now is you've given them a set of skills, you've given them a language, you've given them some visibility, and now they are effectively like your ambassadors in the community. So perfect example, in Benin, one of the things that we saw quite a lot was the community first responders would be on the scene already. Usually they're getting there in 3 minutes, 5 minutes, because again, they're already in the community, right? So they get there, see something happening, and they start providing their own basic first aid. Really, really simple things. Like I said, putting someone in a recovery position, just making just little things. And they're also telling the crowd, give room. You know, the ambulance is on the way. Let's wait. They're coming. When they come, they're going to take care of them. They're going to take them to the hospital, you know, all these things. And because it was like having a voice in the community, an advocate in the community, a voice that people already knew and trusted. And because of that, people were willing to actually participate in the system that had been set up for them. And so, you know, I say all that to say that if we want to rebuild trust, number one, we have to be ready to communicate and over-communicate in all the ways that matter, in people's languages, at the places that they already frequent, you know, using the words that they understand or the analogies that make sense for them. We need to leverage the voices that they already trust, which is their fellow community members. One of the things that we see, of course, when it comes to like maternal health, is traditional birth attendants are preferred very, very frequently over going into a primary healthcare center, and sometimes even for good reason. Why? Because they know that the TBA is going to treat them nicely versus in the primary healthcare center where they can be shouting at them. So on the one hand, we have to communicate, we have to use the voices that they already trust, but then we actually have to deliver the service. It's that simple, right? Because if you do everything else and then you still don't deliver the service, you're wasting that willingness for people to trust, and it gets harder each time. And then I think the last thing, and this is a part that we're really not good at, we have to figure out how to be sustainable, how to be continuous in our interventions. Using the example of Benin, and I won't go into all the details, but eventually that intervention stopped. And it didn't stop because there was no willingness to continue, certainly on our part, on the part of the communities. I mean, we still have all the first responders in groups. And even as recently as last week or the week before, they were like, how's everybody? Is everybody keeping well? I hope people are still saving lives in your communities. So it's just that, you know, they're not organizing us again. You know, so the desire is there. But again, and this is where one of the biggest roles government can and should play is how do you create continuity? Because I can tell you, using, you know, I keep referring to Benin, but I think it was a really good example. We have hundreds of testimonials, hundreds, literally, of people that were helped by that system. And the most consistent thing they said was, thank you, government. Oh, we are so grateful that we did not know something like this can be in Benin, that please, we hope they shall continue. And that was from the when it started all the way through to when it ended, you know, less than 2 years later. And it's because people already know that there's a history of not continuing. And so if we really, 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 really want to build trust, we have to deal with each of those pieces.
Yeah, no, I completely agree with you. In the US, for example, people have to pay for ambulances, and that's also a hindrance, right? And healthcare in general is just expensive, full stop. Nobody wants to bear the full cost of it. So it's got to be, you know, spread across both governments, the private healthcare centers, and also the individual. And I guess that's where, you know, the insurance schemes come in, both the public insurance system and the private insurance system. But just to pull all the things we've talked about together, I've got just the last three questions. What would it take to make emergency care politically non-negotiable? Like, so that it's not a 4-year, 5-year cycle. There's a system change, regime change, and suddenly, as you said, suddenly a pilot program or a program that's been put in place is stopped. What will it take for us to have, as you said, sustainable, consistent, available care so that that trust is there and people will continuously ring the numbers? For example, people have said they've rung the emergency numbers that they know and nobody picks it up.
Yeah, it happens. Or they pick up and they're rude to you.
Yeah.
Or they pick up and they say, oh, somebody's coming and nobody comes. I mean, it happens. Like that is very much the norm. And sometimes you call and they pick up and they come and they do their job, right?
Yeah.
That happens too. Unfortunately, that's still not a system that's reliable, period, right? That is like playing a Russian roulette.
With your life.
If I roll, is it going to come? Is it not? That
Yeah.
doesn't work. I think that is the same problem broadly across healthcare. The people that have the ability to make decisions and shape what healthcare looks like often get their healthcare outside of the system that they're shaping. It's like somebody being responsible for, in quotes, turning on and off the NEPA. I'm just using that as an example. But you have a gen that runs 24/7. You don't feel the effects. So it's not that hard for you to turn it off and decide that for the next 2 weeks is off, right? I think if we're being honest, we need a world where governors don't have the best ambulances in their states. And those ambulances are parked in their residences 24/7 with an on-staff medical doctor and nurse and paramedic and all of that. Don't get me wrong. If you are in government, you deserve to be cared for because you're a human being. That's the reality. But should it be okay that that is your reality, but you have people in the millions often who cannot even count on one, let's not even call it a full ambulance, bus and bed. Like it's that, is it really okay? Is it? So I think that, and that's like broadly across the health system, right? I'm sure you've heard people say like, if people did not used to travel out, travel abroad for care, if they had to do everything here, and I love that. There are more and more institutions that are delivering world-class care here locally. Good. That's the way it should be, right? But until everybody is feeling the pain equally, I don't know how we're going to do it. That's the truth. I don't know. So we'll see.
You just hit the nail on the head, which is the fact that people rely on the fact that they've got staff available 24/7 who can look after them. And that is a different reality for everybody else. And the fact that they can travel out once they're stabilized. Again, I'm going to use the example of across the world, the issues that there are in the UK, there's corridor care, in the US, the challenges are that you don't have insurance, therefore you don't access care until it's too late. In Canada, it's the waiting lists are too long, and therefore you end up in a situation where you're in an emergency. And those are, quote unquote, as we say, the Western world. And here we are, where the national budget for healthcare in Nigeria is, well, let's just say it needs to be reviewed. Yes, exactly. So what message do you have for key stakeholders, people who are at the table, who are making decisions about emergency healthcare, organizations that are policymakers, emergency medicine board in Nigeria? What message do you have for them in terms of strategy, how to just fix the basic thing that in the next year, in the next 5 years, this is what it should look like?
I don't think we lack strategy, right? And maybe some people will disagree. I think that all the things that we've set out to do, yes, some of them maybe as somebody who's been on the ground and I look at the practicality of some proposals, I'm like, I don't know if that's going to work. But I don't think we lack strategy. I think our biggest problem is what I'll call selfless execution. Selfless being the key term. Honestly, we're selfish people, honestly. What I mean by that is if it doesn't benefit me, it's better it doesn't happen. And as long as we continue to make decisions and execute with that mindset, things will, at best, they will move extremely slowly. At worst, which is more typical, not much will happen. And I've seen that in sort of many different spheres. So strategy is not our problem. We're a country of smart people. Honestly, we are brilliant and it shows everywhere we go. So there's no shortage of truly brilliant people in the public sector, in the private sector. The problem is, and I say this as a we, because me too, I'm human. We have to figure out how to put our own self-interest, start to lower our own self-interest, right? And not prioritize it at the expense of the public good or the bigger good. I run a private company. I want to be able to make money. I want to turn a profit. I want my team to be very well paid. I want all those things, and those are good and important and valuable things. Would I choose all that at the expense of the public good, and the public good being, if government comes today and says, oh, you know what, we can't pay you, I'm just going to use random examples now, 100K per transfer, which is what some transfers can easily cost 100K. We can't pay you that, but you know what, we can pay you 50. And again, I'm just using random numbers.
Yeah.
And, that 50, we're gonna pay you within 21 days, and we're gonna, ensure that, the volumes that are coming to you are, I can then go back and say, you know what, now 50 is not my normal. And actually, I don't know how it can work, but is it possible if we do this, if we do that, can we make it work? Or I have maybe development partners or funders that are willing to sort of make up the difference. Can we do that? I think that anyone who is genuinely thinking about how do we make this work for the greater good is willing to do that mental work. But again, the starting point is, if you tell me that's what you're going to pay me, can I trust that 2 years later I'll not be waiting to collect for the first 10 cases that I did? Right? Like those are the issues. So when government wants to work with private sector, the first step is, can they trust you? And if they can't trust you, then the answer will always be no, or they will just be dodging you, which happens a lot. So the struggle is real. I mean, I would say, like, we personally have a deep desire to, cut across sectors and, provide services that can help a variety of people, not just the wealthiest. And that makes our work much more difficult. It would be a lot easier to just focus on the oil and gas companies. And that's the important place. If the oil and gas companies are listening, we want to work with you too.
Let's get Seplat on board.
Yeah, let's be clear. But at the same time, we know that why we started was we wanted to close a gap, and the people that are most in the gap are often the ones that can't afford it. So we take that responsibility. We'll figure it out. Hopefully we'll get there.
Yeah. And I want to close out with, what can an individual do on an individual level to protect themselves, prepare for an emergency? So we talked about the emergency number. We'll put that along with the podcast so people can access the numbers that we have for Nigeria.
So it's 112 nationally.
Yeah.
767 is a Lagos number. Different states also have some other number, but 112 is kind of the nationwide number. Yeah.
Okay. And so what would you say, beyond knowing those numbers, what would you say that individuals need to do to prepare themselves to make sure that if they're in an emergency, they can look after themselves and look after their loved ones? What is the package that ERA has available that, they can purchase ahead? If you're able to just tell our listeners.
Yeah, absolutely. So I think the first and most important thing is just get trained. It's an easy action to take that can make a huge difference. I think, and this applies to all sort of groups of people, whether you're a new parent or a parent of young children. I still have an X-ray from the time my son swallowed a coin. So what happens if your child starts choking, right? Like, do you know what to do? Your domestic staff as well that are caring for your children, or they're caring for the elderly, can they identify when there's an emergency happening, and can they take the appropriate action? Do they know who to call? Do you display it somewhere in your house so that they know what to do? Those are simple steps that an individual can take. Ask your school, your children's school, have they done first aid training for the teachers? Is that something that they require at least once every academic year? Again, simple task. If they're doing inter-house sports, make sure there's an ambulance on ground. Those are little things that individuals can do to start to see, system change. And please, if you're having an event and you're spending 10, 20, 50 million naira on that event, it doesn't take too much for you to spend 300,000 naira on an ambulance, depending on whatever the nature is. Don't see it as another what can keep the whole 50 million that you just spent your sour memory. So those are little things that individuals can do take care of them. Some individual plans on request, and usually it's on the basis of who needs to be covered. So I think maybe what we'll do is we'll share our contact info that you can include along with the podcast, and that way people can reach out. Maybe they have elderly family members that they want a plan household. We can absolutely provide that.
And thank you so much for providing that information. I think, I'm going to do a shameless plug here and say that ERA services are also available on the NomaDoc platform. You can purchase a subscription that allows you to have access to your services. And this is something that we would encourage anyone, both people living in Nigeria and those who are traveling, to make sure it's just, one toolkit that you will have for yourself and to prepare yourself for an emergency and all the things that Folake has mentioned. So I want to say thank you so much. Thank you for talking to us about your why. Thank you for telling us about how your why has driven your entrepreneurial journey and your entrepreneurial journey actually making a real difference to everyday people. So thank you so much for joining us today.
Thank you, IB. Thank you so much for partnering with us as well at NomaDoc. We're very excited to be able to support your clients. And I think, this is just an important conversation. So I appreciate you having me on.
Yeah, no, thank you so much. Really appreciate it.
Yeah, and